you have to come and constantly check every month, every few months, and say, what am I seeing now? Because oftentimes with TCVM, there may be multiple layers of things that are there. And we treat that surface layer that we're seeing on that given day, and there's another layer there that's going to now be exposed. And we'll see that on our next visit.
Dear Horse World, welcome back. Last week, we kicked off a special 2-part episode with Dr. John Langlois, an equine vet with over 40 years of experience, now working exclusively in traditional Chinese veterinary medicine. Through real listener case studies from you, we're seeing how TCVM can be applied in the real world from our podcast studio. Today, in part 2, we're digging into 3 more complex cases. A gelding dealing with insulin irregularities and possible thyroid concerns, a mare with behavioral challenges and heaves, and a Belgian sport horse with a rearing issue and persistently swollen leg. Once again, Dr. Langlois helps us explore these challenges through a TCVM perspective, offering grounded advice, thoughtful insight, and a more holistic view of what might be at play. Let's get into it.
Dear Horse World, it's Dr. John Langlois, and we're back at it.
Okay, everyone, we're back for part 2. And we're going to dive right into these questions. Our next question is from Laura G. And she says, that was a great episode with Dr. John. My horse is a 10-year-old Hanoverian Oldenburg gelding. He has always been prone to insulin issues, but it's never been an issue. On a recent blood test, his insulin resistance was on the high end of normal, and thyroid was well below normal. He's not showing any symptoms, but we're monitoring with diet and exercise. My vet does not want to put him on any medication in case his body does not start producing insulin. He seems like a good candidate for herbal medicine.
I think that's correct. So what I wanted to do maybe, and I think we did touch on this in our first podcast, how effective TCVM is in treating these metabolic issues.
Yes.
And, I've had situations where, let's just take the thyroid, where the thyroid is low, right? So our typical approach is going to be put them on levothyroxine, right? Supplement them. Problem with that is that it probably has to be supplemented for a very, very long time, if not for the entire life of the animal.
Yeah. Because
evidently it's not making enough, right? So I have done this before where I've gone ahead and used levothyroxine, measured their levels prior to putting them on it, keep them on it for 3 months, take them off for a few days and retest them. And every time their level is still low. So we haven't done anything for them other than put a Band-Aid on it.
Right.
So in TCVM, I have 3 different herbals that I may choose, depending upon that particular horse's pattern, to use to try to get the body to do its work. Insulin comes out of the beta cells in the pancreas. Hormonal production in the body in TCVM is under the governing body of the kidney. So the kidney is a very important aspect of treatment for those that have these hormonal deficiencies or excesses. We can have a hyperthyroid too. So I want to know what's going on in that pattern in order for me to choose the correct herbal formula for that. Highly, highly effective. So what I did in many other cases is I go ahead and test them. I put them on the appropriate formula for 3 months. And I maybe done this 8 or 9 times. Every time when I retest them after I take them off the herbal, they're within the normal limits.
Oh, interesting.
And that's the key. And then they go, wow. And I said, no, I don't think you need to supplement. Let's come back in 6 months and retest and see how the body's doing on its own. And oftentimes they're hanging in there doing very well by their own because we put the body in balance. The animal knows how to make it, how to keep it right. So that's the beauty of TCVM is we're not treating the symptoms. We're going again to the root of the problem and going after that and working with that. So yes, herbals are going to be very important for this horse.
I always love these opportunities to then for all of us to get clarity, education. What is the thyroid? What does it do? Why is it important to horses?
Yeah, well, the thyroid is important for overall metabolism of the body. Okay, it governs the metabolism. We know that sometimes when the thyroid's not right, we might be heavy, right? We might be thin, depending upon what's going on with it. But it's responsible for a lot of enzymatic work in metabolism and dealing with sugars and various aspects of, again, body metabolism.
And what's the connection between insulin resistance and thyroid, or insulin in general and the thyroid?
Well, again, TCVM, the kidney is responsible for hormonal production, guiding hormonal production.
Okay.
So if one's out, another's going to be out, perhaps. So in a lot of these cases, we find that they may be both Cushing's, right? Which is a whole little different look because that's produced by adenoma in the pituitary. But hypothyroidism and insulin oftentimes go together again because their origin is from the kidney.
Okay. So again, coming back to the root of the cause.
Correct.
Is so profound.
Yes, and we may have like kidney qi deficiency. Energy's not enough there to do its job. We might have a yin-yang imbalance. We can have kidney yin deficiency, or we can have kidney yang deficiency.
Which means it's overactive.
Well, not necessarily. Not necessarily,
right.
But with a kidney yin deficiency, the body is warm. Kidney yang deficiency, the body's cool,
right.
and cold.
Right.
So we have to put those things in balance. And when that's happening, the kidney can do its work on a proper function.
Right. So it's not a matter of, and I always love how you explain this, even when you're working with my horses. It's not like, so energy, it's not like acting less or more. It's like cool or warm, low or high.
Yes, it's out of balance.
Yes. Yeah.
So that's all we do is balance it out. And it's interesting. I presented a case to one of my classes the other day, and this was a kidney yang deficiency, right? This horse had laminitis. Ooh. This horse was cold, right? So we spent 3 treatments, put it on an herbal. The 4th treatment, the horse was warm. Oh no, I overdid it. No, we did treat that, and now we have actually flipped them into an imbalance with a little bit too much yin deficiency. So now the horse is warmer. Lameness goes away with our work, acupuncture and herbal, but that's an important part of a TCVM practitioner's assessment. If it's not, they're going to be there for life. You have to come and constantly check every month, every few months, and say, what am I seeing now? Because oftentimes with TCVM, there may be multiple layers of things that are there. And we treat that surface layer that we're seeing on that given day, and there's another layer there that's going to now be exposed. And we'll see that on our next visit. Then we alter our way we're approaching them because now we have a little different pattern that we're seeing. So we do change up how we treat. Because I've had many clients say, well, you didn't do that last time. I said, no, that's because I'm seeing something different now. Yeah.
So takeaways for Laura G and ending thoughts?
Well, I think I would trust that the proper herbal, if you can get an acupuncturist to help, that, like I say, that begins the process. But herbals are going to be very, very important. And we see tremendous help. And, at the Chi, we have a lot of what we call frequent flyers. People that are in the local community that really, really see the benefits of TCVM and come and bring their animals. They're on a waiting list to get in there because they're seeing that their metabolic horses are now doing very well and they want to continue that process. So they're back.
Interesting.
Yep.
Okay. Our next question is from Rebecca. Dear Horse World, I've been listening to every episode and I am more curious and inspired by each one. This one hit me particularly hard. My perspective has changed and opened up so much since listening. You are truly making a difference. I have a gorgeous mare that I think could benefit so much from a TCM evaluation and treatment, and I am so drawn to it. I feel she will benefit from it so much since I feel we are so much alike. I will open with, she is my soul mare. but she's complicated. I feel she's trying to tell me so much, but I'm not sure how to process it and help. She has huge energy, and I feel that knowing where it comes from could really help direct me to the root of her discomforts she is having, both physical and psychological. Some background, you did not say to not spare any details. Don't worry, Rebecca, lots of people have been giving us lots of details. Her name is Vanilla Sky, and she's a Seal Bay OTTB, or off-the-track thoroughbred, who found a second career in polo. I met her at Polo Farm I worked at when she was about 6, and I was a groom and I exercised the horses at the farm. I immediately fell in love with her, even though she was a problem horse, quote unquote, from the start. She was a runaway, wouldn't stop, would not clip her you could not clip her mane, would not stand to be groomed, and would try to bite your toes while being exercised. These are all things I was told by the current groom who rode and cared for her. I took her over as my horse, and I found the complete opposite to be true. She was spirited, yes, but not nasty like they painted her. We clicked right away. She never tried to bite my toes while riding her. I rode her bareback in a halter, and she loved it. I just genuinely love her. She was always so sweet with me on the ground, and I was told you had to twist her ear to clip her mane. The thought of that made me sick. I never had to do that to clip her mane. Just a little patience, and she stood like an angel. She had warts in her ears, so they were sensitive, so I paid mine to her, and we got along just fine. Years down the road, I ended up marrying my boss's son, and he gifted me my mare Sky since he knew how much I loved her. He was moving out of state and moving most of the horses with him, so he said, "You take her, it's clear you get along so well." I was so happy. She is so talented, athletic, it's ridiculous. But shortly after she separated from her herd of about 8 to my herd of 4, she started to have some issues. She was anxious, had separation anxiety, and would sacrifice her self-preservation in order to get to the other horses or even act out violently at times. It gave her time to adjust to her new life, and she got a little better. However, here we are at age 24 with her, and we are still dealing with these behaviors. I would love for her to feel at peace with me again and her life, but I feel there is an imbalance physically now that possibly stemmed from her mind. She's still very sweet at times, but she can switch to unreasonable in the matter of seconds if triggers happen. She does not care to be groomed. I am very observant of what brushes that bother her and don't. She is always reaching around and biting her belly slightly, especially in the mornings, even when there are no bugs on her. She has a very intense look in her eyes all the time. I would love for her to have a relaxing retirement or semi-retirement because she loves to work. She is a complete athlete still. She's 100% sound. She shows no sign of arthritis or lameness. The only ailment she has had is heaves. Oh, interesting. Another heaves that developed in the last 3 years, but they seem to have went away last year. They went on grass pasture, which I could finally afford to fence in, for most of the year from a dry lot feeding round bales. We make our own hay, and I take so much pride in our hay being super high quality, so I know it wasn't moldy hay, but my vet said even dry hay can have dust from just moving it around, so it could be from, that's where it came from. But now she has no difficulty breathing, and she gallops around the pasture daily without any problems. Now that I am more aware and open to it, I feel her energy is just off. It's trying to communicate with me, but I don't know how to decipher it. Previously, I always thought on how she was difficult sometimes, or dare I admit to say, I would say, oh, she's just she's just a crazy, we're going to bleep this one, or maybe we won't. The stewards who are listening that are like, my horse just seems off.
Right.
And that feeling is valid.
It is. Yeah. And, many times we don't really focus in on the emotional concerns that a horse has. They're very much real. I remember when I studied TCM, Traditional Chinese Medicine, it seems like every case that came up had some behavioral component, psychological component to it. A lot of them are out there in the horse world too. We just don't recognize them. The importance of, keeping them balanced emotionally. So, but I have to keep emphasizing, and I apologize if I mentioned this in the last session, but here's a case where I've got a thoroughbred racehorse, And he's washing out before a training or exercise or so. He's just getting nervous and not settled, and the trainer's not going to get what he wants out of this kind of a horse. Mm-hmm. So he knows, and I've come in and I've put surgical staples in their head at specific points that are controlling the mind gates.
Wow.
So, and he knows, he called me up and he said, I got 2 horses for you. They're doing that thing. And I'll go ahead and get their diagnosis, right? Whether it's heart yin deficiency, or maybe heart fire coming up. Mm-hmm. And I'll go ahead and do these procedures. Well, one of the other trainers in the barn said, hey, can I get that for my horse? And I said, I should really go ahead and, do a diagnosis. He said, Doc, just put the staples in, would you?
Oh.
So I put the staples in, and she came back to me 2 days later and said, my horse is worse.
Right.
And I said, that's because your horse is sore.
Yeah.
It's not got a mind problem. So we got to fix the soreness, and we're not going to fix it with staples in the head.
Right.
So the diagnosis is so important to understand in order for us to get back to the root and then put it in balance.
Is those staples similar to in TCM? You can put these little things in the ears that people have.
The ear is a whole recognition of the whole body.
So you can do that with horses?
Yes, we put them in right at the end of the forelock.
Wow.
And we put 3 staples in. But I typically will come in and I'll put a needle in. Did it help? Then I'll maybe put some B12 injections. Did it help?
Right.
The next one would be to move to the staples. Mm-hmm. And then we could insert actually a sterile gold bead into that point, and that would be there for the life of the horse.
Oh, wow.
Affecting. It's really cool.
Okay. So lasting takeaways for Rebecca before we move on to our last question.
Yeah, so there's hope to have what your wish is, and that is to have, your horse in a good place for the rest of its life. And the way to do it, again, is to balance that mind. And we know how to do it in TCVM. So we put the mind in good balance, then you're going to have a much, much better horse.
Yeah, and also, Rebecca, I'll add, because John did mention animal communication, there's also a distinction in animal communication in the horse world now where you can actually get medical intuitives as well as an animal communicator. And some animal communicators like to work with the horse directly in physical, like vicinity to the horse. Some would like to do it remotely. Medical intuitives also do. Now there are some available. And again, I would recommend, I don't know what John would say, but I would recommend going off of a recommendation of someone that you know. But if that's not possible, then usually go off of reviews or people that have had success in their work.
Yep. I don't know if you call the California psychics, they will take the horse on, but it's possible.
Yeah, right. Don't call the toll-free number, maybe. Okay, so our last question is from Tina. First, I would like to tell you that I love your podcast. Oh, thanks, Tina. Thank you for doing this and giving us some access to so many interesting people. I would love for Dr. John Langlois to look at my case. I own a beautiful jumper mare called Gina, a 10-year-old Belgian sport horse. I have owned her since she was 7, so it's been 3 years. In January 2024, she started rearing. It would start by her putting her ears back, contracting her body, not wanting to go forward, and eventually rearing. It started slowly and got worse to the point that nobody, not even my trainer, could ride her anymore. Some days she would work normally. Some days she did not want to go forward at all. In May, I moved from Florida to Brazil. I decided to send her to Ocala to be cared for by someone I trust a lot. Good idea. And to be seen there by a vet. She was treated with acupuncture and chiropractic. She was diagnosed with some pain in the left stifle. After only 1 treatment, she could be ridden again. The transformation was incredible. She has also been fighting with a Florida summer sore since September 2024. Oh, I get that. In March 2025, she started having a swollen leg, the same leg where the Florida sore is. I love how she calls it a Florida sore. Yeah, it is a Florida sore. Okay, the entire leg gets swollen, the fetlock, the hock, up to the gaskin. They thought it was cellulitis or lymphangitis. I treated her with antibiotics, but the swollenness did not go down. Oh gosh. I did poultice, furazone, liniment, ice, cold showers, vibrating ice boot, acupuncture, chiro, ozone treatment. It improved, but it never goes down completely. Oh wow. She is out in the paddock whenever it is not raining. She even sleeps out most nights. That improved the swollen leg. When she spends the night in the stall, even with poultice and bandage, her leg is very swollen in the morning, especially at the hock. I also flew her to Brazil beginning April 2025, as I now live here. She was always a rather stiff horse, so she still wants to contract her body, indicating that she does not want to move forward and wants to rear. But with the acupuncture and chiropractic, it is happening less and less. Also, once I feel it will happen, I only touch her with a long whip and she stops doing it. So I am not sure if it is still some kind of pain or she's learned this bad behavior, but I don't know what else to do about her swollen leg and the scar tissue from the Florida sore. Oh, wow. Thanks, Tina, for sending this in and sending all that detail.
Yeah. Well, I'm not sure if the sore is still active or not, or whether that summer sore has gone and that all is there is scar tissue. But it leads me into the thinking that, and one of the things that are beautiful with Dr. Shea, who is the owner of the Chi University, he loves to integrate both Western and Eastern medicine. So in this case, if there is a Florida sore or a summer sore, that is caused by habernema, which is a parasite in the stomach, and you're dealing with the larvae that have gotten into the skin and caused a very intense inflammatory reaction. So like other conditions, EPM, so on and so forth, we've got to get rid of that parasite.
Right.
Western medicine is better at that than TCVM. We do have herbs that can control parasites, but they're not as powerful as some of the Western medicine. So we've got to use it. Ivermectin is beautiful. It will kill the parasite. You have to know how to use it. And I have no problems. There's a number of different compounding pharmacies that make up a combination of ivermectin with a corticosteroid and perhaps some other things. These are beautiful medicines for dealing with these sores, both from an anti-inflammatory part and for killing the parasite. I also have to do ivermectin systemically. You got to take it every day. I mean, every week for a month. That's what I recommend to make sure that that is out of the picture. That's the root of our problem. So, but that presence of that summer sore has obviously disturbed some channel energies coming through the body. Yeah. That limb. Again, we can do wonderful things with electroacupuncture to get that energy moving through the limb. Yeah. Getting rid of the edema associated with it. But firsthand, I want to make sure that the habernemiasis is gone completely. Okay. If that's the case, then we don't have to worry about that. Now we got to work on.
What's habernemiasis?
Habernema is the name of the worm that is in the stomach that deposits the larvae.
That's connected to summer sores.
Right, and it comes from the flies. Okay, that's the cycle. Yeah. So the fly deposits the larvae. So in general terms, fly control is going to be hugely important with managing summer sore. Yes. Keeping the leg bandages so the flies don't do more damage. Yeah. The medications we talked about are going to be important. Yeah. Movement is going to be important because that frog has to pump and you know, we don't want to box these horses up. They're only going to get worse. Yes. So if the habernema is gone, then yes, now we can start to say, all right, what can we do? I like the idea of liniments and poultices. Those all can be very helpful. But getting the channel energy to move. We have specific herbs that work with channel energy. The herbs go into the channels to get them to flow. So once that's beginning to happen, then that edema will go out of the limb.
I love that you bring up the electricity that you guys use with acupuncture. Yes. Because it is, and this is why it's so important that a very experienced and certified person does this. Yes. Because with increasing that energy, you do get to break up stagnant energy that may have been stagnant for like a chronic period of time.
Absolutely.
So it requires a little bit more of a boost.
Exactly. Yes. And I think that I would say somewhere in 80% of the time I'm using electricity on a specific case because I need to get that extra stimulation to get the power in. And as far as her musculoskeletal problems go, I'm going to throw out a name. Dr. Michelotto is a colleague of mine. In fact, we're working together right now on presenting a case for the World Association of Traditional Chinese Medicine journal. And he and I are working on the idea that using a technique of scanning the horse's energy channels, we can appreciate where the problem is 80 to 85% of the time.
Wow.
In any joint or any area. So someone like Dr. Michelotto, myself, and other trained, we can go through the animal. We can say with pretty high degree of assurance that the problem is in the stifle, the problem is in the hock, the problem is in the SI joint, wherever it might be.
Yeah.
Even in soft tissue problems in the forelimb, we can pretty well diagnose those. We can't tell you exactly where it is, but we can say that that's going on. And Western medicine can come and compliment us by saying, oh, there's a tear in that suspensory branch right there.
Yeah.
So
you can save the owner a lot of money in x-rays.
Yes.
Or scans.
I can't tell you how many times, and we've just gone to the problem, got it resolved. And one of the nice things is, let's say I find that the problem is in the stifle. Well, I know which channel comes into the stifle. I'm going to treat that, get it flowing. And if now I go back and rescan and we're much, much, much improved, we don't have to radiograph the horse. We can just say that this is an energetic problem coming through that stifle. And now that we got it flowing, now that we have no more pain or much less pain.
Amazing. I have learned so much in this Q&A.
Yeah, it's cool.
I have learned so much. So thank you, everybody.
Yes, that's a beautiful thing.
Thank you, Tina.
Sent it in, and some of them with a lot of words, but they're helpful.
Yeah.
It's great stories.
Yeah, and I think, maybe we can some lasting thoughts. I know that you've said this to me, and I think this is a really great mention in this episode, is that the background matters to someone like yourself who looks at the holistic picture, right? So I think sometimes when horse owners feel like they're going into excess detail, that detail does matter though, right?
Absolutely. And one of the things that I teach my students is, I said, we call it in TCVM, we call it inquiry. So we might spend 10, 15 minutes inquiring. Okay, how does this horse relate to you? How does this horse relate to another horse? What's going on? Does it have a cough? Is the cough in the morning? Is the cough in the afternoon, in the evening? It's different.
Yeah.
What's going, does it have a skin issue? Well, where is the skin? It's not just a skin issue, but where it is important. So, we've got to go take a really intense look at them and come up with our diagnosis for sure.
So I think, and that this opportunity that we've had to be down here in Florida and to meet people like yourself, just world class, the best in their field. Something that I've found to be consistent amongst the best of the best in each of their fields is that they ask a lot of questions.
Right.
They don't just come in and say step aside, layman person, like, I'll fix this. There's lots of inquiry and lots of investigative questions.
Absolutely.
They paint a picture before they even look at the horse, so that they're trying to extract as much information as possible. And I think as a horse owner or horse steward, I really appreciate that inquiry and curiosity, because then because at the end of the day, our horses we see them every day. So there is information that we can provide professionals that is of value.
Absolutely. And I, again, with my students, I say, keep asking, because oftentimes we find we've done our questions and gotten what we've gotten, and about halfway through it, they go, oh, by the way, he's coughing in the morning. Well, that would have been helpful to have in the beginning while I'm trying to formulate my understanding of the pattern. So that bringing that out, and people like to talk about their horses, so they're very free with giving you the information.
Yes.
So it's very valuable to us.
Because after all, there's no such thing as a stupid question.
It's a great way to finish.
Thank you so much, Dr. John.
You're very welcome.
It's always a pleasure.
Thank you, and thank you for doing this.